Hi, my name is Alana Rabinowitz. I'm a registered nurse working in labor and delivery in Staten Island. I'm coming to the Congressional Committee to discuss one of the key performance indicators from the National Scorecard on U.S. health system performance. The infant mortality rate is an important marker of overall society health. The infant mortality rate is based on infant deaths per 1,000 live births. In 2009 and 2011, the infant death rate was 6.8. In 2014, the average rate dropped slightly to 6.4. According to the CDC, in 2016, the rate decreased to 5.9. New York's rate is on the lower side of the country at 4.6. Massachusetts has the lowest at 3.7, and Mississippi has the highest at 8.6. The benchmark rate is 4.7, so even though the national rate has declined, it is still above the benchmark. The United States is ranked very poorly for developed countries. The rate is approximately 71% higher than comparable countries, as you could see on this chart here. The target rate for Healthy People 2020 is 6.0. If the rates continue to decrease as they are, we will surpass this goal. There are several factors that could lead to infant death. Maternal health, including any health issues such as diabetes or hypertension, could have negative effects on a pregnancy. The quality, consistency, and amount of prenatal visits they receive will also impact their pregnancy outcomes. Drug use is a major issue in the country for the general public, as well as those who are pregnant. Illegal substance use, as well as legal substances such as tobacco and alcohol, could cause a number of problems for a fetus and newborn. It can be associated with decreased birth weight, premature rupture of membranes leading to preterm labor, decreased oxygen supply, placental abruption, and death. Preterm births account for approximately 12% of all births in the United States. In 2015, 17% of deaths were related to preterm labor. Birth defects account for about 20%. These need to be tracked in order to find the causes and prevent recurrences. SIDS is related to 15% of infant deaths. There are programs in place to report and investigate cases of SIDS, as well as provide education on possible prevention. There have been organizations and programs started to help decrease infant mortality. The CDC provides support to perinatal quality collaboratives. These are groups nationwide that are working to improve outcomes for both mother and babies. There is a New York State Perinatal Quality Collaborative, which is working to provide women and infants with safe care. Assessments during pregnancy for high-risk factors and complications must improve. The management of opioid use during pregnancy, as well as the aftercare for neonatal abstinence syndrome, is extremely important. The Southern Public Health Region's Collaborative Improvement and Innovation Network to reduce infant mortality includes 13 southern states in the country. This group's focus is on reducing early elective deliveries, providing women with better risk-appropriate perinatal care, decrease smoking during pregnancy, and implement safe sleeping techniques for newborns. This group has made several positive changes in all of these areas. In 2011 to 2014, preterm birth and mortality was less in these states than other regions. These initiatives need to be expanded nationwide. The key to improving this issue is prevention. Quality would be measured based on several things, such as how well risk factors are being identified, the quality of care the pregnant woman is receiving, how often is she seeing a doctor, what type of education is she receiving, does she have a support network? It's very important that these high-risk infants are being born at capable facilities. Mother's health prior to pregnancy can indicate possible complications. Her health should be tracked throughout the pregnancy. The use of drugs, alcohol, or tobacco would also indicate potential problems. Health policy can help decrease infant mortality rates in the United States. This needs to be done on both a local and national level. 41 states are currently using the PRAMS, Pregnancy Risk Assessment Monitoring System. This is a questionnaire either filled out after receiving it in the mail or on the phone. The intention is to identify high-risk groups and discover opportunities for prevention. The questionnaire includes topics such as attitudes about pregnancy, prenatal care, smoking, drinking, and drug use, physical abuse, breastfeeding, and the participation in programs such as Medicaid and WIC. Health policy is needed to help improve women's health before and during pregnancy. Policies can help provide safe and quality prenatal care. Working in New York and seeing this on a regular basis, drug use during pregnancy is something I'm very concerned about. As of 2014, Tennessee became the only state that considers prenatal substance abuse a criminal act of child abuse and neglect. Most states do consider this grounds for the termination of parental rights, and many states require drug use to be reported. This is one thing I ask you, the Congressional Committee, to consider. Using drugs during pregnancy is a choice made by a woman knowing it puts their baby in danger. I think there should be laws on a national level that consider this a criminal act. I also believe there is still a need for further education on the topic. Women who use drugs before they find out they are pregnant can be placed on programs such as methadone, and I don't believe everyone is aware of that. You can help get public health agencies to work together with healthcare providers to identify social, behavioral, and health risk factors. I'll ask for you to provide funding for programs that can help provide education and care for these women, especially those from poor, at-risk areas. Your funds can help create public service announcements, commercials, and websites providing women with basic information regarding pregnancy, the importance of regular checkups, warning signs of complications, when to seek medical attention, importance of abstinence of drugs and alcohol, and necessary vitamins needed in daily diet. Community outreach programs could be created with the help of community health nurses. They could possibly perform free perinatal health screenings, which would include blood pressure checks and blood sugar checks. The infant mortality rate is slowly declining, and I think with your help it can get even lower. Thank you.